Do you want me to check your blood pressure?
I would.
Yeah, let's do that. So tell me how things have been going.
Last night I was pretty sore at bedtime, but
The thought of navigating on a walker or crutches to go to an outpatient visit would have been daunting.
a little tight, but really.
They could look at the environment here and assess if there were risks to me falling, things that we should be moving.
It's building on the basic things she starts with in the hospital. Again, looking at her home environment and making sure that she feels comfortable navigating, in her own home.
It's tender.
But then just continuing on with working at her range of motion and her strength and those sort of things that are important to work on right away.
You don't hesitate as you step down. Can you then go back up and help with your hand? Now, is that painful at all? The main things that you want to get out of the first 6 weeks, you've got a window of opportunity to get the tissues to start moving beyond their previous level. So you want to get the range of motion back, you want to get the quadriceps muscle to function. How's that? As comfortably as possible on both of those. So one of the things that I do range of motion wise is, and had Beth do from the start, is to have her generate all of the movement so that she doesn't have to wonder, am I going to move her too far?
I have a whole new healthy respect for physical therapy. I mean, I think the surgeon does their good work, but these are the individuals that get us back to doing activities of daily living.
How are things going for you?
Really well.
Good.
Very well.
Pain-wise, you're doing okay?
Yep, not taking anything for pain.
The 7-week visit after a primary partial knee replacement is primarily to try and evaluate how the patient is doing at that point. Our expectations are they have very little pain. They're probably 90% of the way recovered at this point. They're back to their daily lives. They're not taking any pain medication, and they have essentially near normal range of motion.
Actually, the last week before surgery, I could barely walk. I actually had to go home from work one day because my mobility was so restricted. And now I'm out walking on the weekends, in the morning, during the week. I'm on the exercise bike or participating in yoga. Pain-free.